Welcome back,
Welcome
and
back.
it is exactly 8:41, just gone 8:42 a.m. This is News and Views with me, Julie Alli, and next we have Professor Quarraisha Abdool Karim on the line. We're going to be talking COVID-19, and I also know that I did want to talk about the malaria vaccine. It is not her field of expertise, but we're going to throw it out there anyway and just get her thoughts on that issue. Professor Quarraisha Abdool Karim, Assalamu alaikum, welcome to the program.
Walaikum salam, Julie. Thanks for having me.
Thank you indeed for your very valuable time. We do appreciate it very much. And of course, I guess for a long time to come in the near future, we're still going to be having these ongoing conversations around COVID-19, are we not? And where are we now as far as the pandemic is concerned? I spoke to someone from CSIR yesterday, and he indicated that obviously the entire country is out of the third wave. You would concur with that, but going forward, are you as an epidemiologist concerned at all that there's a fourth wave somewhere on the horizon? Could it be worse than what we've been through already? Or is this the breakthrough time that we've all been sitting and waiting for, that we can breathe more easily, and that at some point in the near future we can put all of this behind us?
There's a lot of questions there, Julie, and really excellent one. So let me start with where we are with COVID-19. And, in South Africa, we've just seen the end of the third wave. And, we've now had three waves of surges of infection. And each one has gotten worse. I think the difference now and what will happen. So we've been seeing these waves every sort of, 90 to 120 days. I don't exactly know why that time period between waves. We've seen it in other countries as well and other continents. So will we have a fourth wave depends on a number of factors. One of the things that's different now is that we have vaccines, and we have vaccines available to anybody over the age of 18. And the government has been fantastic in securing these doses of vaccines. And now it's up to us, each of us, who meet these eligibility criteria to ensure that we get vaccinated. And I've seen in other countries where they've reached vaccination rates of over 90%. They've been able to learn to live with the virus. Mask wearing outdoors becomes an optional issue, definitely remaining compulsory in indoor settings. But that's a really important weapon to add to what we already have to protect ourselves. And what we're trying to do is minimize the number of individuals infected, so that we do not put pressure on more mutations emerging or even immune escape mutants coming through, because that's what gives rise to these variants of concern. And when we have a new variant of concern, as we've just seen in several countries, even with 50% plus vaccination coverage rates, we can have high transmission. Importantly, with vaccination and different rates of vaccination, is that you're reducing not only the spread of virus, but you're also reducing the number of hospitalizations. And we know with the surges we've already had, what a tough time it is for the frontline workers, but also the individuals and the families who are losing family members. So it's a whole complex set of things that we have control now in our hands by deciding to get vaccinated or not. How we could have so many impacts on lives, livelihoods, the quality of social living that we have, just by adhering to the things we know work and also through added value from vaccination.
I'm very
So, will we have a fourth wave? When will that fourth wave be? How bad will it be? Those are things that time will tell, and unfortunately, I'm unable to comment on it. But what I will say is that COVID-19, one of many epidemics and pandemics facing the globe. In Africa, for example, we have malaria, HIV, TB, we have Ebola. And so we're dealing with new epidemics, new pandemics in the context of existing ones. And then we shouldn't forget non-communicable diseases, because that's one of the big things that we learned about that got unmasked during COVID-19, and communities that had one or more comorbidities, very common, like diabetes, cardiovascular disease, hypertension, all these interconnected things, and so on. They had a much more higher mortality rates in the context of COVID-19. So we are living in a different era, and it's an era where with each pandemic we learned a lot from HIV that we use to pivot rapidly for our response to COVID. In COVID, it was one of several coronaviruses that we've experienced that enabled the rapid emergence of a vaccine, several vaccines, in fact, within less than a year of the declaration by WHO of this new virus and it as a public health concern. So this is the time we're living in, and I don't know what normal is and what people think are valuable, but I think lives and utilizing tools that we have to save lives is an important foundation for other things. Thank you.
Okay, so we know that obviously COVID-19 is a virus, as is HIV and AIDS, Ebola, but I did mention malaria. That is not a virus, it's a parasitic disease, so pretty different to what we're talking about right now. Can I just digress here for a minute, if you don't mind? The World Health Organization is saying that the long-awaited malaria vaccine is definitely a breakthrough for science. It has been approved by the World Health Organization. They also have been telling us that malaria kills about 500,000 people each year, children included, and this is mainly in Africa. So this vaccine is truly, truly good news as far as the African continent is concerned.
Absolutely. And malaria is a parasite. It requires a mosquito and particular strains of mosquito for transmission, water bodies. We have malaria in South Africa. It's very seasonal and very restricted to parts of Mpumalanga and KwaZulu-Natal. And the option of a vaccine is just amazing. And people have been working for decades to try and get a vaccine. It's been very elusive. So this is really exciting news that we do have a vaccine. One of the things that happened in the early 2000s was the establishment of the Global Fund for AIDS, TB, and malaria. So the GFATM included malaria because of its a huge impact, particularly in low and middle income countries. And, we've seen with some of these conditions like TB, malaria, they kind of neglect what they call neglected tropical diseases. So the kind of investments in terms of finding solutions have not been a very high priority. But with the Global Fund for AIDS, TB, malaria being set up and more concerted efforts and investments being made on these conditions, we have seen lots of progress, much more so in the past a decade and a half than we did prior to the structure being set up. So these kinds of global solidarity type investments that are made benefit everybody. And I think it's a reminder again that when we're dealing with conditions that are infectious, it makes everybody vulnerable. Similarly with TB, where you have extremely drug-resistant strains of TB, that means we don't have anything to treat these individuals who are infected. Those strains of the organism can spread to others, and so even if you're not infected, but you're at risk of getting infected or exposed, nobody is safe, in other words. So these are not things we take lightly, and it's wonderful to see how science is contributing to advancing these different challenges facing humanity. And I think the important thing is that the scientific breakthroughs we have are just an important first step. The really important thing to realize its potential is having uptake of that intervention. So whether it's the malaria vaccine or whether it's COVID-19 vaccines, uptake of that and getting it to people who will benefit most is what realizes the potential and the meaning and the hope that comes to these breakthroughs.
Okay, can we go for an ad break, and we'll come right back to you to continue this very interesting and important discussion.
Breaking stereotypes, moving boundaries, joining hands. Salam Media. Humanity sets the agenda.
Every 60 seconds, a silent pandemic claims the life of a child. Unsafe water is having a devastating global impact on health and livelihoods. Islamic Relief is at the forefront, providing clean and safe water to vulnerable communities around the world. Our tailored approach to sustainable water solutions enable families not just to survive, but to thrive, ensuring they stay healthy and safe. Give water, give life with Islamic Relief.
Looking to get your kick? Kiki's have now reopened on 235 Matthews Maiba Road in Durban. Head on over for the Taste with Kick. We offer something scrumptious for everyone in the family. Wraps, chicken tikka, burgers, tender grills, mocktails, milkshakes, and so much more. Corporate and events catering available. Visit our social media pages for more info or call 031 209 0119. Kiki's, the Taste with Kick.
Reliable access to clean water could save thousands of lives each day. With proper sanitation and easy access to fresh, clean water, communities can flourish. Our Thirst Relief Appeal provides clean water to communities in Asia, Africa, and the Middle East by building deep wells and providing sustainable water and hygiene solutions. A monthly donation of as little as 700 Rand could build a well for a community in need. That's only 23 Rand a day. Donate today. www.pennyappeal.org.za or call 031 11 00 573. Penny Appeal. Small change, big difference.
These days, I'm more health conscious than ever. So tonight it's stir fry for dinner, cooked in healthy Helios pure sunflower cooking oil. Helios is pure sunflower goodness, packed with omega-6. That's good for your heart. And is approved as part of the Heart and Stroke Foundation eating plan. Dinner's ready! Helios, pure sunflower cooking oil. A healthy family is a happy one.
Africa. As the crisis in Palestine continues, the Africa Muslims Agency teams are on the ground facilitating emergency food and medical assistance to the affected families. Donate 15,000 Rand or any amount and help the people of Palestine. Call AMA now on 083-251-9376 or donate online at africamuslimsagency.co.za. Africa Muslims Agency, inspiring the spirit of giving.
Shimmer, sparkle, captivate. Nothing less than a masterpiece. Droplets of gold inspires precious design. Platinum bursts with intricate freshness, and every pure diamond becomes more than just a girl's best friend. Voda Gold Gem Jewelers, where timeless dreams become a reality. Come to us. We tailor-make designer gold, platinum, and diamond jewelry. Trade in or remodel your old gold. Clad yourself with classy name-branded watches. We offer insurance valuation and freezer card calculation. Visit us at 534 Ridge Road, Overport, or call 031 208 9142. Voda Gold Gem Jewelers, manufacturers of fine gold and diamond jewelry.
With up to 97% of Gaza's water supply unfit for human consumption, desalinated water is the only hope to avoid catastrophe. The Al-Imdad Foundation has been operating desalination plants and delivering safe water in the Gaza Strip since 2014. Help us continue providing clean, safe drinking water in Gaza by donating your lila or sadaqah today. Visit alimdad.com or call 0861 786 243 for more information.
Listen to something fresh. Listen to Salam Media.
Welcome back. We're still talking with Professor Quarraisha Abdool Karim. We touched on COVID, we touched on the malaria vaccine, which is a first globally, obviously. And let's just quickly touch on Ebola and then wrap up with COVID-19. We in South Africa, Professor, don't need to be worried about Ebola, or, we do understand that it impacts on people, or people in sub-Saharan Africa are more vulnerable to Ebola. Do we have any concerns about Ebola down south? And what exactly is Ebola all about? It's also a viral infection, is it not?
So, Julie, yes, most of the outbreaks and epidemics have been in Western and Central Africa. But these days, we live in a global world. There's a lot of travel, there's a lot of movement between countries. And if you recall, a few years ago, when we had the major epidemics in West and Central Africa, there was interventions that were implemented in all ports of entry, and primarily on some kind of thermal screening process. So whenever we have an epidemic, while it may be restricted to few countries or few areas, it's still because of the transmissibility of the organism, and it being infectious, and depending on the route that the virus spreads, it becomes a concern for everyone across the globe. And while it's not a high priority concern, and it's not one that's endemic at this stage, it is something we need to monitor closely across all countries and intervene as appropriate and necessary.
There was a case reported of Ebola about 2 months ago. It seems that it was just a very isolated case, so I should imagine nothing to worry about for now. But in terms of what about in that particular country where they do have the problem with Ebola, and then they have this COVID-19 pandemic, it could really be very disastrous for the people.
So the issue about infection, so what's really important in life is we all need to monitor. So surveillance is really essential, and having good quality surveillance in each country enables one not only to transfer that data into, for example, continental databases or global databases. And we've seen with COVID how, for example, our World in Data and the Hopkins dashboard has enabled all of us to access information about COVID globally and continentally, even at a country level. and details within that. Those types of surveillance tools that are linked with digital technologies and monitoring enables more rapid responses. Now that we have an Ebola vaccine that's very efficacious, the surveillance becomes important because when you do have breakthrough infections, you can pick that up very quickly, and then you can try and understand that and intervene appropriately. To some extent, how quickly you respond enables you to contain something. So, we continue, for example, in South Africa with COVID-19 to monitor the test positivity rate in terms of the diagnostic testing that gets done. And those are early indications for us if we're going to be on the brink of a surge. And then the government then uses that data to make appropriate adjustments, either putting in tighter restrictions or if the numbers are going down to reduce the stringency of the restrictions. So currently we're on level 1 because the numbers are down. But, if we have signs and indications of numbers going up, then the lockdown level will be adjusted. So this is all part of an epidemic response. It's about, and because we're dealing with multiple infectious organisms, we need surveillance systems that monitor each of these. And so we have a whole lot that we know about that you've mentioned, but there's also, we have to keep monitoring that there aren't new things that are coming into our ecosystem, putting humans at risk. Because there's an interplay that we have, with animals that are there as part of agriculture or pets or whatever, domestication, and then environment we live in, and then we've got ourselves there. So it's not like we in isolation.
It's scary.
And the other things that are on Earth, that we have to harmonize how we live with each other so that each survives and not a single thing poses a big threat to any of us.
It's very scary as you speak about all of that, but I guess we are directly responsible for all of this, are we not? But having said that, are you comfortable with the uptake of the vaccine levels in South Africa? I do know they've opened it up to 18-year-olds and above. What about the younger ones? What about the preschoolers and school age kids? Are you confident that we should be going that route to further impede the spread of the pandemic?
So, Julie, I think you're absolutely right that with COVID-19, it's in our hands. It's on me, but each of us. And the vaccines offer a really good opportunity for us to learn to live with the virus and get on with our lives and so on. And who gets vaccinated, what our vaccination coverage rates are going to be critical. So we have to think about the vaccine as protecting ourselves at an individual level. So also that by doing so, we will protect those we love, those we work with, and the communities we come from. So where we are with vaccination is really in each of our hands. The scientists have done what they have, the government has done what it needs to do in the doses available, but we can't force people to do what is really will make a difference, which is getting that jab in your arm. That's up to you, and the more we get vaccinated, we can encourage others. And it's not a static thing, because what we've learned over the years, when you introduce new technologies, and there's some people who buy Apple phones, for example, if they know a new product is coming out, they'll be outside that store all night waiting for that store to open.
Yes.
Similarly with vaccines, before South Africa made vaccines available, there were a whole lot of people who went to other countries to get vaccinated. Then you have the group in South Africa who, and other places who are what we call early adopters. As soon as the vaccine became available, they were there first in line and getting vaccinated. Then you have a group that are waiting. They have some concerns, and so we have to work differently with this group. And sometimes you have to create incentives. Sometimes we have to find ways to support and answer the questions and concerns. And then you have a group who, a small group, fortunately, who are just anti-vaccines. And that's a group, you're going to change their mind. They have complex things going on in their heads. But the 95% of us who get vaccinated will also protect those anti-vaxxers. So our job is to encourage everyone around us to be vaccinated, encourage them, support them, particularly those who've already been vaccinated, know and share the experiences in terms of what it means, understand what it is they're concerned about, and try and address it. And I think if all of us play that role, then all of us will also benefit individually and collectively from high vaccination coverage.
Professor Quarraisha Abdool Karim, Jazakallah so much for your insights and your valuable time. Till the next time, go well.
Mere pleasure. And remember, get that jab in your arm. Take care, Chili. And
I've had mine. I was first in the queue. Assalamu alaikum to you.
Wonderful. Walaikum salam.
That was Professor Quarraisha Abdool Karim. She is obviously an epidemiologist talking to us about pandemics, COVID-19. We touched a little bit about obviously world-breaking news, and that is the malaria vaccine that has just been approved by the World Health Organization, and we touched on Ebola. So all very important issues as far as the global community is concerned, and let's take heed. And those of you who have not been vaccinated, please, please, please go out and do the right thing. You'll be saving not only your own life, but the lives of your loved ones, inshallah. Ad break time, and when we get back, we'll be talking some more right here on News and Views on Salam Media. And of course, we're waiting for your comments, so do get dialing on 061 766 0355.